What is workplace-based assessment? It has been defined as the assessment of working practices based on what trainees actually do in the workplace and predominantly carried out in the workplace itself. These working practices that are to be assessed or observed are frequently defined as entrustable professional activities. What are EPAs? They are simply units of practice, in other words, specialty-specific tasks that can be assessed or observed in the workplace. They include both the knowledge and skills, but also competencies such as teamwork, communication, and professionalism that are all required to execute these specific workplace tasks. EPAs can range from procedures to managing in or outpatients to reviewing documentation such as reports, etc. There's also significant variation in how they are defined. They can be single or groups of tasks, they can be very comprehensive, or sample specific index or core tasks of the specialty. This is based on a college decision to define EPAs for that specialty. EPA is also built on the concept of trust, which is useful because it's familiar and it's practiced implicitly daily by specialists as they grant autonomy to trainees. EPAs may also be mapped, and thus a trainee's expected progress per EPA over the years of training can be defined. There are different stakes and different purposes of WBA. Firstly, for individual observations, these are mainly educational, low-stakes events. There are no scales attached to the ratings, there's no pass or fail of these observations, and no marks attached to them. However, these observations, when taken together over a defined period, are reviewed by a group of consultants called a competency committee to make higher stakes decisions, which are still mainly training and developmental in focus. For example, the need for extra support for a trainee in a specific area, whether the trainee is ready to progress to a next level of training, and ultimately whether the trainee is ready to write the college certification exam that will allow them to practice as a specialist. How an observation works in practice: firstly, the trainee identifies an activity they want an observation for, and then ideally informs their supervisor before it starts. Important to note that a supervisor can do an observation without a trainee having to request it. The consultant or the fellow then pays special attention to the trainee's performance. Note the supervisor doesn't have to provide any special testing or quizzing. The task can be executed as it is normally. Ideally, the supervisor then gives face-to-face feedback to the trainee straight after completion of the task, specifically what they did well and what they can do differently. The registrar sends an observation request link via their smartphone app or digital platform. This link is delivered to the supervisor via email and instant messaging. The supervisor completes the observation report on a smartphone, which takes him just a few minutes, and this includes a summary of the trainee's performance as well as the feedback given. This report is then emailed to the trainee and the supervisor, but also stored as a PDF in the trainee's portfolio, and some elements of that report is also added to dashboards that execute specific purposes.